Hi everyone. Today I'm going to take some time to review the current literature regarding gluten and casein-free diets as treatment for children diagnosed with autism spectrum disorders. And when I first chose this topic, I had every intention of choosing a high-quality randomized controlled trial, but after a quick literature search, I quickly discovered that there have not been any conducted thus far. And there are some randomized controlled trials, however, they are all small in sample size and conflicting in their results. So I actually thought it would be better to take some time to go over a systematic review that actually encompasses all of the randomized trials that have been published. So the review paper that I decided to look at is entitled Gluten and Casein-Free Diet and Autism Spectrum Disorders in Children, a Systematic Review. And this article was published in 2018 in the European Journal of Nutrition and was conducted by authors in Germany. So a brief overview. Today we're going to discuss some objectives. We're going to go over background information, the basics of the gluten-free, casein-free diet. We'll touch on the paper's study objective and design. We'll go over some results, discuss strengths and limitations of the paper, as well as some overall conclusions and future applications, and a brief discussion topic. So the objectives of this presentation are to review the current literature to assess the effectiveness of a gluten-free, casein-free diet in children diagnosed with ASD, or autism spectrum disorders. We primarily are going to talk about behavioral symptoms as outcomes. However, we will briefly touch upon gastrointestinal or GI symptoms as well. We'll assess the strengths and weaknesses of this study, evaluate what is needed for future research, and discuss the potential of application of the gluten-free, casein-free diet in this population. So a little bit of background. Autism spectrum disorders are defined by the American Psychiatric Association as biologically based neurodevelopment disorders. They are characterized by persistent deficits in social communication and social interaction, as well as restricted, repetitive patterns of behavior, interest, or activities, with severity based on impairments and symptoms present when social demands exceed limited capacities. And it is estimated by the WHO, or the World Health Organization, that 1 in 160 children have a diagnosis of ASD. And it's important to note that the etiology is not well understood. However, we do know that genetics as well as environmental factors are likely involved. So you may be wondering, why are we considering a gluten-free, casein-free diet for a neurodevelopmental disorder? I know that was my biggest question going into this. So what I found is many children with ASD actually have GI symptoms. So, given that we don't fully understand the etiology, one theory is that the disorder may begin in the gut. So from that, a hypothesis was created that abnormal metabolism of gluten and casein may result in excessive opioid activity in the central nervous system and therefore alter its function and manifest in the symptoms of ASD. Another idea is that increased intestinal permeability, or leaky gut, if you've heard of that before, leads to increased passage of gluten, casein, and their metabolites into the bloodstream and the central nervous system. So having a leaky gut combined with a metabolic defect may contribute towards development of these autistic symptoms. So these ideas and hypotheses and theories are what kind of initiated the trial of gluten-free and casein-free diets in children with ASD. So the study objective of this paper was to systematically update the current evidence on the effectiveness of a gluten-free and casein-free diet as treatment for autism spectrum disorder. So in 2008, a Cochrane review was conducted. However, at that time, there were only 2 randomized controlled trials published. So really just the goal was to kind of see what new data had been published and incorporate that into the review. So what is a gluten and casein-free diet? So gluten is a protein found in wheat, barley, and rye. So it would consist of the removal of all food and drink products that include wheat, barley, and rye. And a casein-free diet would focus on removing all products containing the milk protein casein. So together, these participants are going to have to focus on removing wheat, barley, rye, and milk from their diet. So for this paper, their study design and methods, they only wanted to review randomized controlled trials. So that is the gold standard in research. And then the authors applied some inclusion criteria in order for these trials to be eligible. So studies had to include participants that were children. They had to be diagnosed with ASD according to established criteria. So the criteria included the DSM-4 or ICD-10 codes. You know, it does make sense to me that even though right now we're on the DSM-5 criteria, when these studies were conducted, we would be on the DSM-4, so that makes sense. And then additionally, the studies comparing a gluten-free, casein-free diet to a regular diet were eligible. So they had to have that control group involved. So the authors conducted searches in Central, which is the Cochrane Library, Medline, and Embase from April 2007 to August 2016. And my first thought was, well, why didn't they include PubMed? To which I discovered Cochrane Library actually encompasses publications within PubMed. So that makes sense that they wouldn't also search PubMed. And I felt that the search terms that they included were very broad and comprehensive, and really were able to kind of capture any potential study that may be included in a review paper like this. And you can kind of see it really did reach a wide range of papers. That there were like 785 that then the authors, you know, applied their inclusion criteria to, in which case they ended up with 6 randomized controlled trials. So most studies were removed if they weren't a randomized controlled trial, if they assessed you know, dietary interventions that were not specific to gluten or casein free, and, you know, if they were observational or retrospective studies. So they started out with 785 and then ended up with 6 that were included in this review paper. And I just wanted to quickly show you the 6 different studies that were included. And I just wanted to kind of point out, you can see that the age range varies pretty widely in the population included in these studies. The intervention and control groups are both pretty small in sample size. And you can see that between the different studies, how they applied the gluten-free, casein-free diet to that intervention is different between the studies. Similarly, with the outcomes, you can see that there are multiple different scales that have been validated to assess symptoms in autism spectrum disorders. So you can see that within a study, there are multiple different scales used, and additionally, between studies, different scales are used. So it's kind of important, you know, when you're trying to create this comprehensive overview, to note that there are many differences within the methods of how these studies were conducted. And I also just kind of wanted to give credit to the authors for really delving into these studies and noting that, you know, none of the papers reported sample size calculations. So then that becomes a question of, you know, if the sample sizes of these studies may be underpowered, which could affect results, as well as where funding, if any, came from, as we know that can also kind of influence how research is conducted. So I thought this was just a nice quick overview of the 6 studies included in this review paper. So looking at the results, as I just mentioned, the methods were very different between the studies, and the outcomes that were reviewed were different. So unfortunately, the authors of this review paper could not conduct a meta-analysis. So that is one of the main limitations of this paper. As a meta-analysis really allows you to see a common effect between research studies being conducted. So unfortunately, that could not be done with this paper. But you can see, in total, all 6 trials had 214 participants, 107 in each group, which is relatively small still, even though we've included 6 trials. Looking at specific results, 2 trials did report statistically significant differences in ASD core symptoms between the groups. However, it's important to note that these differences were only in specific subgroups on certain scales that were done. So some of the subgroups that found statistical significant differences were communication, social interaction, autistic traits, social contact. And I also just wanted to point that daily living skills were also reported as being statistically significantly different. But this was based on parent surveys that they filled out, so not on any type of validated scale. A different study reported that compared to the gluten-free, casein-free group, the control group actually had statistically significant improvements in visual reception and withdrawn subscales. However, within the same group, conversely, they found that the gluten-free casein group had reductions in aggression and ADH subscale scores. So actually, at the end of the study, when everything was done and post-intervention comparisons were being conducted, they found no statistical significances between any of the groups for any of the subdomains of the scale. So it's also important to note that, at the end of that study, nothing was statistically significant. And I also just wanted to briefly note that of the 6 studies included, 3 of them did evaluate GI symptoms as well as behavioral symptoms. However, all 3 studies reported no statistical significant differences between the groups. So the gluten-free casein group compared to the control group of the regular diet. So some strengths and limitations. Main strengths of this paper were its rigorous methodology. The authors only included randomized control trials. They really delved into the papers themselves and reviewed funding sources, considered reporting of sample size calculations. Even before they looked at the papers, they really implemented some good methods to help reduce any bias from the beginning. So, their literature search was very comprehensive. They even searched websites of ongoing clinical trials. They identified their inclusion criteria before they looked at any of the papers. They did not restrict on language, and they didn't restrict on year of publication. So overall, the methods of how this paper was conducted was very strong. The main limitation, as we briefly mentioned earlier, was that we were unable to conduct a meta-analysis for these review papers. And within the paper itself, the trials that were included had a lot of limitations as well. So there were small sample sizes of trials, unreported sample size calculations, studies had differing methods of diagnostic criteria for ASD, the age range was very wide among the trials. They didn't identify potential confounders such as puberty onset, pharmacotherapy, presence of anxiety or depression. A lot of the trials were shorter than the recommended observation time of 4 months, so most of them were less than 3 months, which is important for validated psychometric testing. And then for some of the studies, they use parent-reported scales. So it's important to note that placebo effect can come into play where mom thinks or dad thinks that, child's getting treatment. So they, that really influences how they're answering these survey questions. And the one that I really wanted to point out that I think is most important when you're looking at outcomes regarding to diet as an intervention is that only one trial looked at the diet adherence, and that was not even conducted by a registered dietitian. But even so, they found a lower diet adherence for the gluten-free, casein-free diet group compared to the regular diet group. So, it's really important if we want any type of validity in terms of the results of outcomes that diet adherence is being monitored within these trials. So for overall conclusions, these trials included in this review did find some benefits, but only in specific subdomains of ASD score symptoms and on certain scales. Majority of the data was insignificant between the gluten-free, casein-free, and control groups. So overall, the evidence is limited and current data does not support the use of gluten-free, casein-free diet in children with ASD. For future studies, we really need to see a large sample size, high quality, multidisciplinary randomized controlled trial in order to further understand the effects, if any, of the gluten-free, casein-free diet on outcomes in children with ASD. So quick discussion, I know in research we typically talk about the risk-benefit ratio. None of these patients had any adverse effects, so we know there's really not any risk to the patient trying the gluten-free, casein-free diet. However, I wanted to kind of pose this idea of a burden-benefit ratio, the burden of these families or even the child themselves trying to stick to and create this gluten-free, casein-free diet for themselves when there's likely already limitations in the foods included in these patients' diets, given their specific palates that they really focus on. So I just think that overall we need to kind of remember that these are still people and families, and trying to create a dietary intervention would be great if we can have the data and the evidence to really show the benefits and make sure that the benefits really outweigh that burden of the family of trying to focus on the diet. So that was all I had for you guys today. Thanks for your time, and this is my reference of the paper.